The misuse of malaria medicines is driving a surge in recurrent malaria cases, placing Nigeria among the top contributors to global malaria infections and deaths. Experts from the National Malaria Elimination Program stress that the key to reducing this burden lies in enforcing proper case management, ensuring swift, accurate diagnosis and treatment paired with environmental sanitation measures to prevent the spread. Here's the report.
Malaria continues to be a leading cause of illness and death worldwide, with Nigeria bearing the heaviest burden, accounting for 66.7 million cases in 2022, or 27% of global malaria cases and 31% of death, according to WHO reports. A major challenge in Nigeria's fight against malaria is the widespread misuse of diagnosis and treatment methods, undermining efforts to curb the disease.
It's always important that we test every fever case that comes to the hospital. Okay? It's very, very important we test, just so that we're able to accurately or treat the disease, confirm it, and then treat it appropriately. By doing that, you will save the person the economic implications or the economic burden of the disease. You will prevent the risk of drug resistance, because these organisms too are also trying to survive. So your business is to ensure your drug hits them at once. So, but if they are not, and you keep exposing the organisms to the drugs, they develop tolerance and they just resist.
So for diagnosis, if you're to diagnose malaria, we have two major ways in the country presently. You diagnose either using a rapid diagnostic test kit or you diagnose with microscopy. There's something we call clinical diagnosis. That is based on the signs and symptoms. That is not what effective case management requires.
Experts warn that the proliferation of substandard malaria drugs, improper use of diagnostic tools, and incorrect dosage regimens are fueling the problem. The unchecked availability of non-quality assured treatments is compounding the fight against malaria.
The government is making concerted efforts to check all of those. And for every drug candidate you see that we're using, all of them are undergo what we call the therapeutic efficacy testing. It's just like watching them in segregation. We're checking for allergy, we're checking for their efficacy, okay? If they have adverse effects, they're quickly withdrawn.
So when you're having resistant forms being transmitted, that means a large population of people will be taking medicines that will not be working. And that's going to put us at a very, very dangerous state in country. We do not want that to happen. So it's expected that once you have been tested and you're positive for malaria, you get treated using ACTs. We will continue to hammer it, ACTs, and not monotherapies.
There is a strong emphasis on using artemisinin-based combination therapies for treating malaria. Experts warn that monotherapies are not recommended as they contribute to the development of resistant malaria strains, allowing resistance to further spread. Aisha Salihu, Trust TV News, Abuja.